I think what's important to understand about this study at the outset is that it's a feasibility study. To backtrack a little bit, we know that adolescents and young adults with type 1 diabetes struggle with glycemic control or control of their blood sugars more than any other age group. And we also know that cardiovascular or heart disease is a major risk factor for morbidity and mortality in our patients with diabetes and certainly with type 1 diabetes. So what I was hoping to do with this study is to understand whether we could use digital health, which is certainly a platform that adolescents and young adults are more engaged with than other age groups. But to use that relationship with their devices to try to see if there's a way we could teach them more about cardiovascular risks, and then secondarily promote the uptake of this knowledge so that they can apply it to increase heart healthy behaviors. So the aims of this study were essentially to, when we do technology studies, I think one of the main things we need to do is make sure that the technology works. So so that's the point of the feasibility part of the study. So we need to know, does the study work? And then do the teenagers participate in the activities? And then what feedback do we get from them about what they felt about doing the study and whether they enjoyed doing the study? So in terms of those outcomes, certainly we did find that teenagers in both the control and intervention groups did engage with the study in general. And that those in the intervention group who did use the mobile app and participate in the activities reported high satisfaction. And in fact, most of them reported that 3 months were too short for the study. So that's a really nice thing to hear from teenagers, that they would have wanted to spend more time doing the activities. So we divided the group into intervention and control participants. So the intervention at baseline did a module that basically taught them about heart healthy eating, hypertension, and lipid or cholesterol knowledge, and then had some teach back components and basically just engage them, gave them knowledge and engaged them with the concepts, the basic concepts behind heart healthy behaviors. And then halfway through the study at 1.5 months, there was a second module that was done over video, similar to this, that were approaches to managing the high blood pressure and lipids. And the entire time, those in the intervention group used an app called Pacer to be placed in teams, and they would complete challenges. So some examples of the challenges were: text a picture of a high fiber food that you're eating at least 4 days a week, or walk over 7,000 steps in a day. And the Pacer app had the ability to actually track the steps. And so the participants got points if they completed the challenge. They lost points if they did not complete the challenge, and they gained extra points if the whole team completed the challenge. So there's kind of a layered reward system built in. And at the end, they got a certain amount of money for every 30 points in the study. So the financial reward was at the end of the study.